Now to China, where the hospital system's coming under an increasing strain as COVID spreads quickly again. It comes after the government's decision to abandon its zero COVID approach. The situation is so bad that doctors and nurses who've got the virus are being told to turn up for work anyway because of staff shortages. Stephen McDonnell reports from Beijing.
Long lines have been forming outside Beijing's clinics after an explosion of infections, triggered by an end to China's zero-COVID approach. Hospitals have increased their fever ward capacity, expecting a huge influx of patients. People in this country have been used to going to hospital to treat any illness at all, but now they're putting massive pressure on the system. So doctors have taken to social media to try to explain that with mild cases of the virus, recovery at home is recommended, a new concept for most here. Going to hospital can also be potentially dangerous at the moment, according to one specialist, who says patients could be catching COVID from doctors and nurses.
From my conversations with friends in China who serve as the hospital directors or medical workers, people being infected have been required to work in the hospital. So which create a transmission environment there.
It's not just hospitals that are under pressure. Panic buying at pharmacies has meant certain medicines are now hard to come by. This sign says no cold and flu tablets, no thermometers and no home testing kits. Just weeks ago, Chinese officials were saying lockdowns and isolation centres were necessary. Now, after a major U-turn, the message is that the latest COVID types aren't dangerous, and many younger people are welcoming the chance to isolate at home.
The information circulating before about COVID was completely at odds with my experience of the virus. I caught it, was a bit uncomfortable, but it hasn't been nearly as scary as I thought it would be.
She does, however, worry about her sister, who has 2 children, her parents and her grandmother. In other countries, reopening led to bustling streets as communities again came together. Beijing feels like a ghost town. Most are either recovering at home or afraid to go out, lest they too become infected.
Companies in these tower blocks are imploring staff to return to work, but they're having a difficult time convincing employees to re-enter crowded offices. It looks like China is in for a tough few months before life returns to anything like normal.
Amongst those being overloaded are home delivery drivers, and many of them are also catching COVID. So orders are piling up with not enough drivers to handle them. Zero COVID may be effectively over, but this virus continues to wreak havoc in China. Stephen McDonnell, BBC News, Beijing.